one alcoholic beverage per day, no more than 7 a week. And I'm not telling people to drink every day.
This episode is not going to be for people who are addicted to substances.
Doesn't matter if you have addiction or not. For everybody, it slows down the brain activity. That I'm worried, I'm concerned about this or that particular thing in my life. It shuts that off. It also shuts off your good judgment. It shuts off your ability to properly weigh and balance risk. It also affects the memory centers and the amygdala, which is our burglar alarm, our emotional memory center. It shuts those down.
Oh, I have the addiction gene. And I'm like, there's no such gene that you can measure. I'm Dr. Esra, and I've been living a sober life for the past 19 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead Podcast. Today, I'm joined for the third time by Dr. Susan Blank, triple board certified and one of the most trusted experts in addiction and brain health. We're breaking down the newest alcohol guidelines, and the message is direct. No amount of alcohol is safe, according to the World Health Organization. Dr. Blank and I break down the surprising truth that daily drinking may actually be less harmful than binge episodes. The leave it all to the weekend approach. If you don't drink, don't start. If you do, please stop. This episode clears the confusion and shows you the real impact of alcohol, so you can protect your health with facts, not myths. This episode of Soberhead Podcast is brought to you with the support of Gedik Foundation for Education. For over 30 years, Gedik Foundation has been providing opportunities for youngsters, children, and women to realize their dreams through scholarships, projects, and social work. And we're proud to be on this journey together. Investing in education is investment in the future. Subscribe and support us in our quest to bring you the most current scientific data and continue your access to the world-renowned experts in their fields as guests on Soberhead, with Turkish translation and completely free of charge. Comment on the episodes, like, and share. Dr. Susan Blank, welcome back for the third time to Soberhead Podcast. My mentor, my friend, someone that I look up to, and also you are a rare kind because you're a triple board certified, addiction psychiatry, forensic psychiatry, and on top, functional medicine. So that's why your take on any type of substance use, whether recreational, and when I say substance, it can be alcohol, it can be drugs, it can be both. So whether recreational or addictively, your approach is much different than many millions of psychiatrists who are interested into treating addiction. We discussed that, why you picked that functional medicine part in previous episodes. We would add the link so people can look at it. But in today's world, when the medicine changed from diagnostical to preventative, the way you look to mental health as well as substance use from a functional medicine perspective. What I mean by that, and then we can start into our questionnaires. What I mean by that is when you do your 2-3 hours sometimes intake, you never sit down with a patient and you diagnose them with depression until you see all their blood work, their brain imaging, their whatever screening that you can do in order to make the proper diagnosis, rather than just hey, you're depressed, you're manic depressive, you're ADD. You just you want to see really what's happening in their biology. With that said, the reason that I gave this explanation to my audience, now I have a very loyal audience that they're very literate with science. All of them know that I'm in recovery. So this episode is not going to be for people who are addicted to substances. They may learn something, but I want to more address to people why they should really pay attention if they're, especially if they're interested any type of longevity, you know, but let alone for everything. Because in these days, when we compare to the past, my understanding is there are multiple researches out there that showing, let's take actually maybe alcohol as in most of these examples, like alcohol causes cancer. Alcohol causes long-term use may be linked to dementia. Alcohol use definitely is linked to gut dysbiosis. Like alcohol use can be really causing a lot of problem without people knowing it. So how do you think we should start to this?
So I would like to just, and thank you for inviting me to be with you today, because I think this really is important, and most people don't necessarily consider alcohol a toxin, which it really is, or other substances that people may be using recreationally. And it's important to know that it's not without risk. In fact, in 2024, the World Health Organization stated that there is no safe level of alcohol use. No safe level.
Why?
Because of the broad effects that alcohol has all over the body, both immediate effects and then longer term effects and sometimes lethal effects. So they're recommending no alcohol use
Mhm.
because of this toxicity. And because alcohol is taken when you consume it, it goes throughout your body in your bloodstream and it enters every organ, it enters every tissue, and it is very difficult sometimes to avoid any kind of toxicity as the alcohol begins to break down. It's not the alcohol itself, it's that first metabolite of alcohol that causes all the problems.
Can you tell me more about the first metabolite? What is that?
When you consume alcohol, in men, the breakdown of that alcohol starts in the mouth and in the stomach with an enzyme called alcohol dehydrogenase. And this starts that process of metabolizing it. That alcohol dehydrogenase converts alcohol into acetaldehyde, which is extremely toxic. I tell people it's kind of like formalin, what we use to embalm people. It is toxic. Women don't have very much of this particular enzyme, so they don't begin that process of breaking down until it hits the liver. And so there's a whole another topic we could talk about is why women are more at risk than men from the toxic effect. But that acetaldehyde is extremely toxic. It's a free radical or a reactive oxygen species. And so it is missing an electron and it's looking around at
Oh, wow.
tissues, at hormones, other things to pick up an electron. And that begins part of the process of why it is so destructive throughout our body.
Oh, wow. I didn't know that. It's the first time I'm hearing. So, like, literally, that's why it goes everywhere in your system to find that missing electron.
Right.
Wow.
So it's looking for the missing electron. If your body has a lot of antioxidants around, if you've got the B vitamins, vitamin C, and if your liver has enough glutathione, then it can help neutralize this while the next step in the breakdown of alcohol happens, which is with aldehyde dehydrogenase. And this enzyme turns that reactive oxygen species into acetate, which your body can handle, and it's not bad at all. But there's that one first step where it is very toxic. And it is that one first step that if someone doesn't have adequate vitamins and antioxidants, if they are overloaded with other toxins, that you've got a lot of that acetaldehyde floating around in your system, to your brain, to your heart, to your pancreas, your liver, everywhere it's going, and it's unstable and it's looking to find an electron somewhere, and usually not in a good way.
It will go to a place that more you're kind of weaker in your system, more like affect that area, because I keep seeing that same theme in a weird way with COVID, with autoimmune disorders. It's like whatever piece of organ that you're really not strong at, the toxins kind of goes there. Is it the way it works?
And that's part of it, absolutely, because it's looking, and its primary source of electrons that it likes are the cell walls, all of the cell walls, whether
Oh,
it's a neuron, whether it's a cardiac cell, or mitochondria. That's where it's real easy for it to pick up an electron, but then unfortunately it impacts that functioning of that cell. And sometimes it's not too bad, but very often it can actually disable that whole cell and the whole pathway of whatever that cell's supposed to do, and actually change the DNA so that the cell is not producing the protein or the hormone that it needs to, or not doing it in a proper way.
well, then I would like to focus actually around the brain first. I sometimes post and you watch why alcohol is a toxic chemical. And oh my God, I have people like, oh, life is not good with that, blah, blah, blah. And everybody, they do not need to be an addict or an alcoholic like I was or I am. But, so most people we hear that it makes me feel relaxed. Let's say I came home from work, and, I had a stressful day. And I just actually the other day, I had a patient sitting in front of me, and she'd been diagnosed with a possible MS-ish like something. And she had an anxiety disorder. And the psychiatrist that she visited for the anxiety after the MS suggested her to have a drink when she feels anxious. I mean, that was really difficult for me to understand. How come a psychiatrist, especially with someone who has an MS, possible MS diagnosis, give that? But what happens in the brain? What is the whole mechanism?
So for thousands and thousands of years, humans and animals have sought out fermented fruits and have sought out sources of alcohol because it does two things, and it's very good at it. And the two things that it does are, number one, it releases dopamine. So that's the feel good chemical, the one that makes you feel happy and comfortable in your own skin. But it also releases GABA. And GABA is the neurotransmitter that calms you down, helps you relax, helps you go to sleep. And it's very effective. It gets in the system quickly because there's the blood flow to the brain up through the carotid arteries, takes that alcohol right to the dopamine and GABA centers very quickly. And those two neurotransmitters are what make people like the effects of alcohol.
What happened then after?
Well, it depends, of course, on how much one drinks and over what period of time, and a lot of other things. But the first thing it does is relaxes. It slows down the brain functioning for everybody. Doesn't matter if you have addiction or not. For everybody, it slows down the brain activity, and it affects the prefrontal cortex. It takes it offline, that I'm worried, I'm concerned about this or that particular thing in my life. It shuts that off. It also shuts off your good judgment, and it shuts off your ability to properly weigh and balance risk. It also affects the memory centers, the hippocampus, which is the big storage relay center for our memories, and the amygdala, which is our burglar alarm, our emotional memory center. It shuts those down to one degree or another, sometimes relating or resulting in people really not being able to remember anything they did or said while under the influence of alcohol.
Mm-hmm.
These are not people who have addiction. This is anybody can take in enough alcohol to have what we call a blackout. They're
Mm-hmm.
not passed out. They're up, walking, talking, engaging with folks, but their memory center has been completely shut down.
But it comes back the next day, does
Generally,
it? Generally, okay.
well, not, I mean, the ability to have new memories, but that person may never fully recall what they did or said
Mm.
because the memory just was not logged in. It just was not stored and it was not changed from an immediate memory to a longer term memory. So that it may not come back. Their ability to remember does to a
Mm-hmm.
point, but that's
Mm-hmm.
when you get alcoholic dementia, when these two organs deep in the brain are damaged to the place where they cannot put down new memories at all.
I was going to come to that. So most people, like, I'm sure you know so many people as well, they do drink and they're not considered an alcoholic or they're not considered that they have a substance use disorder. Yet they drink all the time. And because they don't, that loss of memory, that prefrontal cortex malfunctioning is not continuing to the next day, they're thinking that they don't have a problem. Maybe, yeah, they don't have a problem. At what point that usage can become problematic? Is there a certain amount, certain many days, certain many years, certain chemicals, heavier chemicals, certain spirits? Is there like anything that people can, after listening to this, okay, can we measure with quantity? Let me ask this way.
So if you look at the recommendations from the Centers of Disease Control in the United States, for example,
Mm-hmm.
they have recommendations for what they call low risk drinking.
Mm-hmm.
And it's not no risk, but low risk. That somebody following these guidelines are less likely to have some of the long-term organ damage that you can see. And so that recommendation is for women or anyone over the age of 65, men or women, one alcoholic beverage per day, no more than 7 a week. That doesn't mean I don't drink Monday and I didn't drink Tuesday, so on Friday I can
Okay.
take those extra ones and have 3. No, it still means 1 per week. For a man, it's 2 alcoholic beverages. And the studies have shown over 5 years that if you drink this amount and no more, then you are much less likely to develop cancer, liver disease, cardiac problems, some of the other impacts that alcohol can have. So that's considered low risk. The important thing is what is the actual amount of distilled alcohol. It's 1.5 ounces is 1 drink.
Mm-hmm. Okay.
An 8-ounce beer of normal gravity that doesn't have high octane alcohol content. If you're drinking white wine, that would be 5 ounces.
Mm-hmm.
You're drinking red wine, that would be 4 ounces is a
Mm-hmm.
standard drink. So understanding that most people get a whole lot more alcohol and call it a drink than what is really recommended. So they may order 1 drink, but they're actually drinking 1.5 or 2 drinks by how they pour that or how the bartender mixes it for them.
So then how is it the new guideline says that no alcohol is safe?
Well,
There's a bit of a,
there's a bit a disconnect. So,
yeah.
no alcohol is what the World Health Organization says.
Mm-hmm.
No alcohol. If you don't drink, don't start. If you do drink, please stop.
Mm-hmm.
If you're going to drink, then to reduce, not eliminate, but reduce the actual impact of alcohol on your body, then one standard drink for a woman or anyone
Okay.
65 is going to be least likely. You go above that
Mm-hmm.
and you're going to have a problem. Or if you binge drink, people, and I'm not telling people to drink every day, don't misunderstand. But if you binge drink, that is actually more toxic to your brain, your liver, than if you drank every day. So if you save up and say, "Oh, well, I can have 7 drinks in a week. I'm a woman or I'm a man over 65. I can have all 7 drinks on Saturday night." That is extremely
It's
dangerous.
interesting. Okay, it looks like to me what you're explaining is like I did a good podcast with Jenny Goodman, and this was about toxicity in our household materials and skincare products and etc. He says like it's like a chronic toxic exposure. So basically, what you're saying, 1 glass a day, it would be a low-level chronic toxicity that you're facing. Yet, depending on your metabolism, if you can clean out these toxins through your system, then you may have a lesser chance to have anything bad happening to you because your detox system is working fine or better than others. But if then, because I want to come to cancer, but if you have already in your household, in your work environment, and in your car and areas that you live in, already there are some toxic burdens like pollution, lots of plastics, lots of, let's say, cleaning materials that are super chemicals. So all these things that you're exposed to already fill out your level that you can clear out. Then when you start adding, even it's 1 drink a day, then it's kind of like the drop getting out of the glass. The glass is already full that you cannot tolerate. So can you tell me the link between alcohol use and increased risk of cancer? Because these days it's out there a lot about like alcohol causes cancer.
Yes, and I know in the United States, they're moving towards warning labels on distilled spirits and on beer and wine,
Mm-hmm.
warnings about cancer,
Mm-hmm.
because we know that it is probably the leading risk for women with breast cancer. Leading contributors. Alcohol is one of the leading contributors to breast cancer in women and colon or rectal cancer in men. It is also really important, and speaking about the toxins, the mouth cancers, esophageal cancers, stomach cancers, these kinds of cancers are from the direct exposure because you're
Mm,
drinking alcohol.
yeah.
If you're drinking alcohol and smoking at the same time, which many people do, that increases the ability for the toxins from nicotine and from smoking to actually penetrate these tissues as well.
Mm,
So you have this very clear link with cancer. And you asked a minute ago how is that possible?
yeah.
So that acetaldehyde, our little toxic free radical,
Mm,
um, is attacking the cell walls, which allows things to get inside the cells that shouldn't, and things to get outside the cells that shouldn't. And it's attacking the mitochondria and the DNA.
mm,
And DNA, which is important. It's the blueprints that we have that our cells repeat over and over again to do whatever it is they're supposed to be doing. It modifies the DNA to the point that now either those cells just die or those cells turn on in a way that they shouldn't, and they're making more of the products or reproducing the cells, or they're doing it incorrectly. And this is some of the basis of the cancer. The other thing acetaldehyde does is it activates the immune system. So our immune system is going, oh, wait, this is a toxin. What are we doing? We need to get in here and shut this down. But this hyperactive immune system then begins that process of inflammation that we know can be contributory to cancer formation and other diseases.
So basically, we have to look, when we look to alcohol as a toxic material. Why breast and colon cancer? And whatever the third one was?
Yeah, and the esophageal, tongue,
Yeah.
mouth cancer. So one of the things that we know is partially responsible for some forms of breast cancer, not all, but estrogen. And alcohol impacts estrogen levels in two ways for both men and women, but more for women because there's more estrogen. So estrogen has to be detoxified by the liver so that we don't have these huge levels of estrogen, or we don't have any estrogen. Our liver has to break down estrogen to keep us having a normal levels that we need for our reproductive cycles and so forth. When the liver is now called upon to detoxify this alcohol, and it's using up all of the antioxidants and it's using up all the glutathione, what happens is the estrogen levels get higher and higher.
Okay.
So for both men and women, they're going to have higher levels of estrogen. Men who drink a lot, you may have noticed, get what we call man breasts. And they have increased production of breast tissue. And it can actually increase their risk of breast cancer if they have an estrogen-induced breast cancer gene or situation. The other thing is that it impacts another enzyme called aromatase. Aromatase is an important enzyme that takes all of the androgens like androstenedione, testosterone, these kinds of hormones, and it breaks it down. But this increases aromatase activity. So for men and women, it takes whatever androgens you have, the male hormones, and it converts them much more quickly to estrogen. So now you have increased levels of estrogen because all of your testosterone levels and so forth are being broken down to estrogen more quickly. So you, if you have an estrogen sensitive breast cancer, it's going to have this impact to increase your risk of breast cancer.
Oh, wow. Okay. Now I understand much better. I mean, after listening to this podcast, I'm wondering what people would think because it's really toxic. But it takes time these to build up, correct? It's not like 5 days, 10 days, 15 days, but it's years after years of accumulation of these toxic materials in your system. And whether you live a healthy life or not, it's very related, I assume.
Absolutely. And if you eat well and you get plenty of fruits and vegetables and you're generally healthy, you're not taking a lot of medications for other health conditions, your liver does a really good job of detoxifying things. It's an amazing organ, let me just tell you. But over time, it just can't keep up, and the damage starts to be done. And you're not going to know it. These are things that, again, like you say, happen over time. So you may not be aware for a long time that you have been slowly poisoning your yourself and poisoning your organ systems and just creating havoc in
I,
your body.
I want to go back for a second to the brain while you're talking. I thought of something else because, I'm kind of visualizing all the people that I know who are drinking. And so what happens or why it happens that I often see some people who drink, they have a tendency, again, without being an alcoholic, without needing to have a treatment or whatever, but they become more agitated while not under the influence. Very agitated or very depressed or very snappy or very emotional. What happens? Some things changes in the brain that are causing that?
Yes, because if you think about the brain, it's the ultimate recycling center. We have this blood-brain barrier that keeps large molecules, big bacteria, these kinds of harmful things out. But that means that the brain has to scavenge. It has to go out and find the different molecules, enzymes, minerals, amino acids, fatty acids, all of these things to make the neurotransmitters. When you're using alcohol, remember it's releasing the dopamine to make you feel
Mm-hmm.
good. It's releasing GABA to calm you down. Now, you're releasing GABA not because your body says we need to calm down, or I'm meditating, or I'm breathing, or I'm doing the things to normally release GABA to help me
Mm.
still myself. You're releasing much bigger amounts of GABA than you normally would. Now you have a shortage of GABA. So when the alcohol wears off, your little GABA cells are having to scavenge from everything else within the brain to make more GABA, and you don't have it. So now you've got this imbalance of GABA, which is calm you down, and glutamate, which is gets you going, gets you motivated, gets you doing things. But glutamate is toxic at higher levels. And so you have this balance of GABA and glutamate to keep you, pretty stable, pretty normal in your management of anxiety or agitation or aggression. But now you don't have enough GABA, and it
Mm-hmm.
takes a minute to make it, replace
Oh.
it. And you've got this toxic glutamate. So your blood pressure goes up, you have all kinds of other issues, and you're more irritable and you're more likely to be anxious.
Mm.
So even if you didn't have some anxiety before, without this balance of GABA and glutamate,
Mm.
you are much more likely to be irritable, anxious, and if you do have anxiety, you're going to be more anxious than you were before you took the alcohol to calm yourself down. And it becomes this vicious cycle of,
Sure. So basically, I think with how you explain this cycle, often when we chat about addiction or the programs that I did about addiction, there's not one gene, one specific gene. I don't even know, like, I sometimes get people, like, said, oh, I have the addiction gene. And I'm like, there's no such gene that you can measure. But I don't know, some centers, it seems like they just come up with that gene. I don't know. I never heard of it, but, and you didn't. But so basically, that's the tipping point, what it sounds like, when if you have some genetic disorders, and that may not be something hugely bad, but maybe some GABA deficiency, maybe some serotonin deficiency, maybe some dopamine deficiency, or vice versa, whatever. And when you add alcohol or other substances in the mix, and then how you explain the other mechanism like seconds ago, then you tip the balance. So you were already having a hard time to keep up, and then that's like suddenly tipped off. And then also the brain says, okay, I need to have that drink in order to release the GABA because I'm not able to release it by myself. So that's kind of the tipping dangerous point that, when the brain suddenly gets like, uh-oh, like, all right, my balance is messed up, but I have something that I can fix that. And then it's not you, it's the brain actually wanting the alcohol to be able to balance itself.
And it works in the moment until it works less and less well, because you don't have those extra stores of GABA for the alcohol to push out into the system. Um, so it's not quite so good for calming somebody down. It's not quite so good to help you fall asleep. It messes with your sleep cycle, but in a different way. But because you have already been depleted of some of these neurotransmitters, your brain, it takes weeks to refill and restore. And our brain is used to having a certain ebb and flow of all of these neurotransmitters to keep our mood and our sleep and our focus, our attention, our ability to learn, all the things our brain helps us do. And now we've just messed it up. And everybody's scavenging to try and find the raw ingredients. And sometimes we don't have them anymore because we're trying to detoxify alcohol everywhere. So all of our antioxidants have been sucked up in the liver or in the pancreas or in the breast tissue, wherever it is. So we have fewer and fewer resources in the brain to make the neurotransmitters. And it just can be really, really very difficult, especially if you're not eating well or if you have other metabolic problems.
With that said, I want to kind of touch base for a second on the way that you and, most good rehabs in the United States do is not jumping on medicating someone when they check into your practice. The way that you explained, the messed up neurotransmitters, excessive or not that excessive use or substance, alcohol or whatever, anything, they come to you and the brain is not able to find these neurotransmitters, and that can be valid, I think, for most any drugs with any different type of psychiatric like observation that you have. It may be schizophrenic behaviors, it may be heavy depression looking feelings, and so on and so forth. So is that why you kind of stop to give any medications and rather wait to supplement them and feed them to kind of help the brain to maybe reboot?
You're exactly right, Esra. It's easy, particularly if you only have a little bit of time, to jump in and try and make a quick diagnosis and give somebody a prescription. And sometimes when people come in for treatment, they're in physical withdrawal. They're in danger, like with alcohol withdrawal. They may have a seizure. I've got to give them medication,
Yeah.
to help them get through that acute risky phase. But I want to know what's going on, and I want to rule out other metabolic problems that may be causing or at least contributing to some of the symptoms that they're having, including cravings. So there's if we have the time, because the person isn't acutely suicidal or in withdrawal, then I want to test them. I want to see their blood work. I want to see, using acute EEG, how their brain is functioning. I want them to take some screening tests to see how is their memory, how is their reaction time. Do they have trouble, particularly with alcohol, in the cerebellum, which is our balance? So there are maybe other things that I need to look at, like their thyroid. Thyroid disorders can look very much like psychiatric disorders. And yet, if you give somebody an antidepressant because their thyroid is underactive, it's not going to work. Because that's not what the problem is. The problem is we've got to look at what's going on with the thyroid and see if we need to replace that hormone. So I want to know a lot about their vitamins, their minerals, the way that their organ systems are functioning, so that we can intervene in a way to be most helpful. And that's really such a big part of my practice because honestly, when I just practiced traditional psychiatry, only about a third of my patients got better. And that's because I was giving them antidepressants, and that may not have been at all what they needed. They may need more vitamin D or B12 or folate. So I want to make sure that we're treating the whole person and the whole system, and that our interventions then help not only repair some of the damage, but help them to be more productive and more healthy overall.
When do you think the psychiatry is going to catch up with this?
Well, I think it is. If you read the literature, and I get the American Psychiatric Association journal, and I look at the Journal of the American Medical Association, and I look at Lancet and other publications, we're starting to see more brain imaging. We're starting to see more genetic testing. We're starting to see more metabolic testing and hormonal testing. And there's this movement. More and more doctors are getting involved in integrative and functional psychiatry. There was a very good panel that I just attended back in July, psychiatric meeting, where they were talking about vitamins and supplements and neurofeedback and red light therapy and some of these other things that in the functional medicine world are pretty commonplace now.
Sure.
But we're starting to see it. I'm starting to see it in more mainstream psychiatry, but we're a long way from having everybody buy in, believe, and take the time to do the work.
It needs to be, because I often face patients that they tried classical psychiatry. The thing that I hear is that they've been giving hands full of psychiatric medication. And basically it's not working. I don't even understand why doctors are still doing it, because it is not working. Maybe it's working 10% of the time, maybe 20% of the time, but 80% of the time it's not working. It only makes the person very tired and very like zombie-like, and they are feeling like they don't want to take these medications because they cannot lift their head from the bed. So is that living? I just kind of don't think so.
And that's the very description, Esra, of where I was with my patients. Seeing them, I've got this tool, I've got this prescription pad, and I know all of these antidepressants and these mood stabilizers and these antipsychotic medications and these medicines for anxiety or for sleep or whatever. But my patients, some of them got better. They did. But many of them were not better. And that discouragement drove me, as we've talked about before, I need something else. I need to understand what is going on. Why is this not helping my patients? Because why are they coming to see me? Why are they paying me their good money if I'm not able to help and they continue to suffer? It's very discouraging, but that's the tool that they have. That's what we learned in medical school. That's what we have learned in residency and advanced training. Right.
But I firsthand watched, we worked on a few clients together here from Turkey, and I was able to see your approaches, and honestly, you never gave to any of them an antidepressant. I mean, it was mostly supplements and hormone triggering agents, and if any, maybe some anxiety reducing helps. But people who thought that they could never reach a year of sobriety, they all reached and passed. So I mean, it's just so evident that things needs to change. I want to be a little bit touch on the gut, because you drink and it right away goes to your like stomach, then to your gut, and we are now, it's just like, it's undeniable that the gut is just like, it seems like if you don't have a healthy gut, you may end up anything, thyroid issues, Alzheimer's, heart disease and whatnot. How is it affecting the gut? And also the next question following that up, if someone's gut is disrupted, can they cause other psychiatric issues or look-alike psychiatric issues?
Our gut has more bacteria and fungus and viruses than we have cells in our body.
Mhm.
So I don't know who owns who or who's running who, but our gut, our microbiome is so very important in all kinds of signaling and protection, but also obtaining nutrients. So alcohol is really toxic to a number of good gut bacteria. That's important not only for protecting the lining of the gut, because we eat things and we are exposed to things that would be very toxic if they got into our bloodstream. So that our intestines, our stomach, all of these things are really important to protect us and also to be able to extract from the food that we eat and the substances that we drink the good nutrients that we need and the minerals and the amino acids, all of those things. So that process is a delicate balance, and you have to have the right kind of bacteria in there, and we don't want the bad kind. But just like with all the other cells, what happens is this acetaldehyde is very toxic and it's going to kill off good gut bacteria. It's going to allow an overgrowth of other bacteria and fungus. We see a lot more Candida or Candida, depending on which side of the
Accent.
it allows overgrowth of this bad bacteria that then prevents the lining of our intestines from being able to absorb things like calcium or vitamin D. It also allows this breakdown of the lining and allows things to get into our bloodstream and into our body that we should not have allowed in, and creates all kinds of havoc. It overactivates the immune system. Again, our immune system is so helpful, but when we've got an immune system that is constantly having to take away the power of this acetaldehyde, now we've got inflammation, we've got fat being deposed or laid down in parts of our body that it shouldn't be. We're having all kinds of difficulty in terms of making our neurotransmitters. So this is the second part of it. 90% of serotonin, and I'm sure your listeners are very familiar with serotonin, which is one of our neurotransmitters that regulates our mood and our sleep and our sex drive and a lot of things. It's a very important neurotransmitter. 90% of our serotonin is made in our gut. And this greatly impacts the production of serotonin and can interfere with the messages to the brain. It allows an overpopulation of not good bacteria that actually craves alcohol.
I was just going to come to that because the recent book of Stephen Gundry, he mentioned that actually he shared that on the stage that, there are certain bacteria in the gut, the bad ones, that will actually crave literally alcohol. So if you fix your gut, you may have a good chance of reducing your cravings.
Exactly. And that's one of the reasons that one of the first things that I give to my patients is a really good probiotic that has things like Saccharomyces and other kinds of bacteria that alcohol and other drugs destroy. So repopulating the gut is really, really important, and stopping the toxic exposure from the alcohol or other substances, very important. And then to heal and replace and get rid of that bad bacteria. And if you think about alcohol, it gets converted to sugar really quickly. It's empty calories. And if you use mixed drinks, very often there's additional sugar added. So again, the bacteria that crave sugar now overpopulate the gut. So you see people making less wise food choices, craving high sugar foods, craving more alcohol. Alcohol is a really quick source of sugar. So it creates this own vicious cycle of I want more. My brain's not calming down enough, so I want more alcohol to help with that. My gut is not working properly, and this other bacteria is saying, drink more alcohol, that will help. It becomes very, very difficult for people, and they're wondering why. Why am I eating sweets now? And why am I wanting more alcohol? And again, these don't have to be the patients that come to see me with addiction. This can be anybody. And
Yeah.
come into the holiday season where there's going to be a lot more potential exposure to alcohol, holiday parties, family get-togethers, these sorts of things, celebrations. Alcohol is often a part of it. And so is a change in our diet, and we eat more sweets. We can really mess up our gut pretty quickly in a very short period of time. It only takes a couple of weeks to really mess up our microbiome and inhibit our ability to protect ourselves and also to absorb the nutrients we need.
I'm jumping subject to subject, but something super important came up to my mind now because I was looking to my questions that I sent you. So I faced a fair amount of young girls who are having bulimia, the eating disorder. They are bulimic, and they are at the same time alcoholic. And you were extremely, because like it's important to share, I guess, you were extremely concerned for these people of their alcohol consumption may be actually really, really dangerous. Can you share why you were extremely concerned?
I mean, on so many levels. The binging and purging, again, maybe, as we were just talking about, some of that binging and wanting particularly high carbohydrate, high sweet things could be related to the gut bacteria.
Mm-hmm.
When you purge, when you are purging, I'm meaning with either vomiting or with laxatives to
Mm-hmm.
you loose bowels or diarrhea, or you're purging with exercise. All of it can upset our electrolytes, our levels of sodium, potassium, all of these salts and minerals that are in our bloodstream that make sure our heart beats correctly and our muscles contract and all the things that they do. When you are purging, you are getting rid of these things. You're getting more dehydrated. When you've got diarrhea, you're losing a lot of these really important minerals that can impact how your heart beats, can impact how your brain thinks, and can impact, certainly other organ systems. And we talked about the drinking of alcohol and what it does to the esophagus. We can have a situation where the liver is so congested because it's full of fat and scarring that now the blood can't get down correctly and go through the liver. And you get what we call esophageal varices. So these are enlarged blood vessels in the esophagus. They're very big, they're very bulgy, and they're not very stable. And when you vomit, you can rupture these and you can bleed to death. So when somebody is inducing vomiting because of their disordered eating, and they've been drinking and they have created difficulty for their pancreas and their liver, now they may also be risking actually with the vomiting, even more risking that they may rupture these big unstable blood vessels and bleed to death very quickly.
But your concern also was also the drinking part. You said that, on an empty stomach that I think so it goes to the brain much faster. I think you had like the drinking part also a lot of concern to you, not just the eating and purging part.
So that goes back to this alcohol dehydrogenase. That little enzyme, women don't have that very much. Therefore, when they drink, they haven't started to detoxify the alcohol. So they get much more alcohol absorbed into the bloodstream, and they get the full dose of alcohol hitting their brain, where it starts to be detoxed in the brain or hitting the liver, where it begins to be detoxed in the liver. So they get a bigger dose than men do, because men have already started that process because they have that enzyme much more abundantly in their stomach. So they're getting a bigger dose of alcohol, even though they drink for drink with the men. The toxic load that hits their brain and hits their liver is much more severe, and it can cause all of the damages to the neurotransmitters, to the memory centers, to the judgment centers, and to the actual myelinization of the brain. The brain starts to shrink, and we see problems again with the cerebellum, with balance and walking. We see judgment problems. We see personality change.
Because of the amount of the alcohol. And I think also, isn't it that there's a secondary, really, really negative thing to the brain is because they don't take nutrients from food, so their brain don't have any nutrition to work or recover properly, and the only thing they have is alcohol. So basically, almost like you're not eating anything and you're only drinking.
And this happens a lot. The satiety center gets satisfied sometimes because of the high sugar load in alcohol. So it actually curbs their appetite somewhat. And so they don't eat and they're purging. So what they might be putting into their bodies, they're getting rid of before it is properly absorbed. And so the malnutrition, particularly to their brain, that depends on having all of these B vitamins and all of the other nutrients that are necessary for making the neurotransmitters and for the brain to work properly, they aren't there. So we see really significant cognitive impact at a much earlier age and much faster. It's worse for women in general, but if you've got a woman who has an eating disorder and they really are not consuming proper nutrients, it is a disaster, and their brains do not handle this well, and they do not function properly, and it may not be reversible.
So it will kind of lead to alcohol dementia.
Correct.
Yeah, that's really important. I really wanted to put this in there. As my last question, we experienced that together. Why people who take antidepressant needs to really pay attention to their, especially vitamin B level? What happens?
There's a couple of things that happen with vitamin B12 and vitamin B9 or folic acid and vitamin D. These are very important in the brain for making the neurotransmitters like serotonin, like melatonin, our sleep hormone, like GABA, like dopamine, like glutamate. All of these important regulatory neurotransmitters in our brain are made, and they need these raw ingredients. If they don't have them, then you may be taking an antidepressant that's saying to your serotonin cells in your temporal lobes, which are, I call the earmuff parts of the brain, make more serotonin, make more serotonin. If antidepressants aren't giving you serotonin, they're stimulating your brain to make it. And the brain's going, okay, we will, but we're missing B12, we're missing folate, we're missing fish oil, the omega-3s, we're missing vitamin D. We can't make it. So you can stimulate it as much as you want, but they don't have the raw ingredients to make it. So the antidepressant doesn't work. If
Mm.
you look at the individual and you see that their vitamin levels are low, then the first thing to do would be to get those normalized, because very often, now that the brain has the raw ingredients it needs, now it can make the serotonin, now it can regulate mood, now it can make melatonin to sleep, now it can make dopamine to help with concentration and motivation. So making sure the raw ingredients are there is really very important. And sometimes it just takes that little tweak to actually allow the person to have an effect from their antidepressant.
So basically, what we're saying here is that it may not be the antidepressant that you're taking is not working. So it's not worth to keep switching one to the other to the other. I mean, obviously they don't, but the doctor gives. But it's crucial to check your vitamin levels and mineral levels in order to see if that's the problem.
Correct.
Wow. So everything is so connected, yeah?
It it is. It is amazing how our nutrition, our health, our lifestyle, and our toxic load can have a huge impact in ways that we would never think are related. Never think.
You know, people mostly think that alcohol makes them sleep. And I often read in places or listen to a podcast that actually it sedates them and it's not giving them a healthy sleep that is regenerating their brain. It's just like they're sedated, and that's not a sleep that they would like to have. Why is that?
Sleep architecture is very important. So we go into, various stages of sleep. Alcohol puts us into deep sleep pretty quickly.
Mm.
But then it does not allow us to go into REM sleep, rapid eye movement sleep, where we dream and where we offload all of the things we learned and said and did today and put that into our memory system. It is not allowing our body to regenerate, because now we're having very disrupted sleep. So,
Mhm.
like many sleeping pills, they are, some of them, like alcohol in a pill, they put you down, but they are not giving you the normal sleep architecture that someone needs. So it's a really important point, Esra. And in asking a history about how someone drinks, I want to know when they drink and why they drink. And so many people will say, well, I have a couple of glasses of wine before I go to bed so I can sleep because my brain won't shut up, blah, blah, blah.
Mhm.
So I know with that particular person, focusing on good sleep hygiene and maybe some medications that might give them more normal sleep architecture, using, neurofeedback or using red light therapy. Some of these things can be really helpful. If it's, I drink because I'm anxious, or I like the buzz that I need to be the life of the party, having indications as to why and when they think about using alcohol can really help also guide what are you going to look at to see what might be wrong, or what are
Mhm.
some other safer, less toxic interventions that you might be able to make to help them with those struggles
Mhm.
and prevent them from poisoning themselves.
Thank you so much. I think this was an amazing episode. I was waiting for this. You know, we never talked about substance addiction or anything like that with you. We spoke about like hormones and supplements and so on and so forth. But I was waiting for to be able to have enough audience in order to give some information around alcohol, and they can, they can use alcohol as one substance, and whatever substance that they use recreationally, because they're toxic anyway. There's no any non-toxic substance. Therefore, they can implement that into their life. And if after listening to us, maybe they may consider of like looking to what they're doing. Maybe they're doing really good, and they can say like, well, I'm really good. I'm only drinking one drink like every other day, and they can say, at least not be concerned, because most people who follows me now, they have this question in their mind, oh, I'm drinking every day, am I an alcoholic? Or, you know, for their partners and so on and so forth. In a way, self-diagnose them, you know, their health, and not just for addiction, but also if they are in a healthy state physically and they have to check certain stuff.
And just knowing what the recommendation is for low risk drinking can allow them to enjoy alcohol and really minimize the toxicity of it.
Thank you so much.
Thank you. My pleasure.